Welcome to the second main part of our topic on medicinal chemistry. In this video, we will start to talk about the structure-activity relationship of drugs affecting our CNS. Under central nervous system, drugs are categorized according to therapeutic action. Our drugs can cause excitation and inhibition, or we refer our drugs as CNS stimulant, the one that produces excitation, and CNS depressants, the one that causes depression. This time, we will talk first CNS depressant drugs. So aside from CNS depressants and CNS stimulants, we also have sedative hypnotics, anticonvulsants, and antipsychotics. Now let us begin with our lecture on CNS depressants. We refer to it also as anxiolytic or anti-anxiety and sedative hypnotic agents. So we have different examples under CNS depressant. First, the very big group of GABA A receptor modulators, followed by melatonin 1 receptor agonists, and then atypical acetylpyridine drugs, and we have miscellaneous drugs, antipsychotics and anticonvulsants, antidepressants, and sedative histamine 1 antihistamine 1 receptor, and beta adrenoceptor antagonists. So let us discuss first our GABA A receptor modulator, the one that controls our gamma aminobutyric acid. So gamma aminobutyric acid is a major inhibitory neurotransmitter in the brain. It produces calmness of our central nervous system because it inhibits nerve transmission. It is useful for treatment of insomnia and addiction. So our GABA receptor, the one responsible for the release of our neurotransmitter, looks like this. And it has different sites. So we have a GABA site which can be agonized or antagonized. And then we have the specific site for barbiturate, specific site for benzodiazepine drug, a specific site for steroid, and we have also for picrotoxin. Generally, these sites will help release of our neurotransmitter GABA in the brain, and which results to the influx of chloride ion that causes hyperpolarization and causing inhibition of our nerve transmission. So our sedative hypnotics that are involved with GABA receptor are the following. We have benzodiazepines, barbiturates, and other drugs such as buspirone, chloral hydrate, zaleplon, zolpidem, rameltion, and tasimeltion. So for our benzodiazepine and barbiturates, they are categorized according to their duration of action. There is a short-acting drug, intermediate-acting drug, and long-acting drug. Aside from our sedative hypnotics and anxiolytic agents, they are ideal sedative that would produce adequate CNS depression to reduce activity of our brain. It can reduce excitement and generally have a calming effect. So it can be useful to different situations such as insomnia, hyperactivity, surgery, and drug abuse. Hypnotic agents are used also to produce drowsiness and initiate and maintain sleep. Furthermore, our GABA A receptor modulators acts in two types of receptor, the ionotropic GABA A and GABA C, and the metabotropic GABA B receptor. So our GABA A receptor modulator is a target for many anxiolytics and sedative hypnotics, the one that we have mentioned a while ago. It is a ligand-gated chloride ion channel, and upon activation, it causes increased influx of your chloride, hereby producing pronounced hyperpolarization, resulting in neuronal inhibition. So, these are the main groups under GABA A receptor. Benzodiazepine, they commonly ends with zepam, except for chlordiazepoxide and alprazolam here. They bind to specific benzodiazepine binding site on GABA receptor, also called as BZR. They are sometimes called BZRAs or benzodiazepine receptor agonists. On the other hand, we have non-benzodiazepine hypnotics or the Z-drugs. Their generic name starts with letter Z, the zolpidem, zaleplon, and zopiclone. And the third major group is barbiturates.